Do you have dark spotty patches on your face that just won't go away? If yes, you might be dealing with a type of hyperpigmentation called melasma. Welcome to Medical Knowledge. In this video, I'll tell you about melasma, its signs and symptoms, its causes, and how to treat it safely. If you want to get authentic information about other various diseases, please subscribe to this channel. All the videos here are authentic and are made by medical practitioners. Melanin is the pigment that gives our skin its color. It is produced by cells known as melanocytes. When melanocytes go into overdrive, it can cause melasma. Though anyone can have it, it is particularly common in females, especially pregnant ladies and those taking oral contraceptives or hormone replacement therapy. Melasma are dark, irregular, and well-demarcated patches on the sun-exposed part of our skin, especially the face. They can vary from the size of half a centimeter to 10 centimeters and grow gradually over time. The most common area where the patches appear are on the cheeks, nose, upper lip, forehead, and chin. Melasma does not cause any other symptoms other than cosmetic discoloration. Melanocytes are stimulated when they are exposed to the ultraviolet radiation present in the sunlight. Even a small amount of exposure is enough to cause melasma. It is most common during pregnancy. It is also called mask of pregnancy. Women taking oral contraceptives or hormone replacement therapy or the medicines to treat ovarian, thyroid, or epileptic disorders can make the skin photosensitive and cause melasma. Melanocytes are active in people with dark skin and they can easily get overstimulated. African, Asian, and Hispanic population get it more often. Women who develop melasma as a result of pregnancy often see the patches fade months after the baby is born. Women who take oral contraceptives or hormone replacement therapy often see the patches fade once they stop taking the medications. Protection from the sunlight is a necessary part of treatment of melasma. Sunscreen with SPF or sun protection factor of 30 or more should be applied every time before going in the sun, and it should be reapplied every 2 to 3 hours if the exposure is prolonged. Your sunscreen must contain chemical as well as physical blockers like zinc oxide and titanium oxide because ultraviolet A, ultraviolet B as well as visible light can stimulate pigment production. You should put sunscreen even in cloudy weather. You can wear a hat with a brim to shade or protect your face. You can also tint the glasses of a vehicle to reduce the exposure. There are many depigmenting creams that are easily available in the market. Hydroquinone is a chemical that blocks the natural chemical process that leads to the creation of melanin. It can be found in 2% strength, which can be easily purchased over the counter, or 4% strength, which you can buy only after consulting a dermatologist. Triple combination creams formulated with hydroquinone, tretinoin, and a steroid component have shown to be more effective than dual combination therapy or hydroquinone alone. After using depigmenting creams, maintenance cream containing kojic acid, glycolic acid, and arbutin can be used. If melasma does not respond to these creams, then other various procedures including chemical peels, microdermabrasions, and laser surgery have also been available. But the results so far have not been consistent. They act by removing the layer of skin and have a potential to cause skin irritation. If you have any queries regarding melasma, you can write in the comment box. What do you want our next video to be about? Please do like, comment, and share. Thank you.